Can advanced imaging find the cause of bladder retention? Have you ever wondered how doctors figure out why someone struggles with bladder retention? Bladder retention, or the inability to fully empty the bladder, can be caused by many different issues. Advanced imaging techniques are key tools that help healthcare professionals identify these underlying causes. These imaging methods allow for a detailed look at the urinary tract and surrounding structures, which is essential for diagnosing bladder retention. One of the most common imaging techniques is ultrasound. This non-invasive test uses sound waves to create images of the bladder and kidneys. It can measure how much urine is left in the bladder after urination, which is known as post-void residual volume. Ultrasound can also detect bladder stones, assess bladder wall thickness, and identify hydronephrosis, which is swelling of the kidney due to urine buildup. Because it is safe and widely available, ultrasound is often the first choice for evaluating urinary retention. Another important imaging method is the computed tomography scan, or CORT scan. This technique provides detailed cross-sectional images of the abdomen and pelvis. It is particularly useful for spotting pelvic or abdominal masses, tumors, or an enlarged prostate that may be pressing on the bladder, neck, or urethra. A CORT scan can help identify serious issues like malignancies or anatomical obstructions that could be causing retention. Magnetic resonance imaging, or MRI, is another advanced imaging technique. MRI offers high-resolution images of soft tissues without using radiation. This is especially valuable for assessing neurological causes of bladder retention, such as spinal cord compression or conditions like multiple sclerosis. An MRI of the brain may also be performed to rule out any lesions that could affect bladder function. Avoiding cystourethrogram, or VCUG, is a specialized X-ray test that shows how urine flows through the bladder and urethra during urination. This test can help identify functional or anatomical problems, such as strictures or reflux, that may be contributing to retention. While not an imaging scan, cystoscopy is also important. This procedure allows doctors to directly visualize the bladder and urethra using a camera. It can help detect tumors, stones, or strictures that might be causing retention. In addition to these imaging techniques, urodynamic studies are often used to assess bladder function. These studies measure pressure and flow during the bladder's filling and emptying phases, helping to distinguish between bladder muscle dysfunction and outlet obstruction. From the perspective of bladder health and bladder cancer, advanced imaging is crucial for several reasons. It helps detect bladder tumors or urethral strictures that can cause retention. It can identify prostate enlargement or malignancy that compresses the bladder outlet. Additionally, it evaluates neurological conditions that may affect bladder emptying. This comprehensive approach guides treatment decisions based on the specific cause of retention. In summary, advanced imaging techniques such as ultrasound, computed tomography, magnetic resonance imaging, and specialized studies are effective in identifying the structural, neurological, and functional causes of bladder retention. These tools are vital for accurate diagnosis and timely intervention, supporting both bladder health and cancer detection. However, it is important to remember that imaging is usually combined with clinical evaluation and other diagnostic tests for a complete assessment. Always consult a healthcare professional for personalized medical advice.